Well, good morning. I'm Jagendra Rana. Our topic of the discussion today is mental health insurance in India. Mental health insurance in India. See, Bollywood stars like Deepika Padukone, Shah Rukh Khan, Manisha Koirala have shown courage by openly sharing their battles with mental health issues and their journey to seek help. Hollywood celebrities such as Justin Bieber and Selena Gomez have also joined the conversation, breaking the stigma by publicly acknowledging their need for therapy and support. So, their willingness to speak up has sparked discussions on the importance of mental well being. Yet, for many, accessing professional help from therapists, counselors, or psychiatrists remains a costly affair. So, while the average cost for a therapy session ranges between rupees 1000 and rupees 4000, it can go much higher depending on the therapist's expertise and experience. Some therapists in Mumbai charge as much as 7,000 for a 50-minute session. The rates vary widely based on the professional experience and the investment of time and energy that goes into each session. So, mental health insurance can play a vital role in the alleviating these expenses. The Insurance Regulatory and Development Authority of India guidelines from 2019 mandate mental health coverage. So, according to the IRDAI, around 60 to 70 million Indians suffer from mental illness. Fortunately, awareness for mental health is rising, as is the importance of ensuring comprehensive medical coverage to support it. But this can be achieved by having a comprehensive health insurance plan because all standard health policies in India offer coverage for conditions like anxiety, depression, and post-traumatic stress disorder, that is called PTSD. The standard health insurance plan in India cover inpatient treatment for mental health conditions, while some offer outpatient department coverage for therapy session, consultation, and prescribed medications. So, plans with an inbuilt OPD feature extend financial support for diagnostic and doctor consultations, either physical or through telehealth services. Leading insurers like ICICI, Magma, SDI, Future Generali, India Insurance, Niva Bupa, Aditya Birla, and Star Health provide outpatient mental health services as part of their coverage. These insurance plans are designed to provide comprehensive coverage for a range of mental health conditions. Hospitalization due to conditions like anxiety, stress, depression, and PTSD is covered under the policy, provided the said hospitalization is medically necessary and prescribed by the treating medical practitioner. So, mental health treatment often requires ongoing therapy session, which can add up over time. Tata AIG Medicare Premier, for instance, offers coverage for post-hospitalization expenses, allowing for therapy session if prescribed as part of the post-hospitalization care. But the mental health care treatments are often long-term and repetitive. To provide flexible coverage in the product is the need. See, the Star Health Insurance has also addressed this need by providing unlimited teleconsultation with specialists as part of its wellness service benefits. They offer a wide range of coverage for mental health conditions. There is no cap on the number of admissions covered for mental health treatments, provided each admission is medically necessary and requires in-hospital care. Beyond traditional therapy and treatment, insurers are introducing wellness programs to support mental health. Star Health's Mind and Body Wellness program includes resources like psychology programming, mindful movement, breath work, and meditation, all available online to ensure easy access. These wellness programs aim to enhance mental health by providing tools that can be accessed at no additional cost. Addressing mental health issues through such holistic measures can have a lasting impact. Magma HDI and Future Generali India Insurance offers specific mental health coverage for conditions like severe depression, schizophrenia, psychosis, and more. Their compasses for mental illness works just like it does for any other illness. Customers can opt for cashless treatment at any hospital of their choice with just 48 hours notice. They also provide free telecounseling service to offer support remotely. Future Generali India Insurance further covers mental health in multiple ways through curative therapy, outpatient treatment, and preventive therapy, that is counseling. Their policy includes coverage for therapy session and medications prescribed by the psychiatrist, ensuring a comprehensive approach to mental health treatment. Here is a breakdown of comprehensive health insurance plan for a 25-year-old adult located in Delhi. C1, the Care Supreme plus OPD care. Base premium is only 11,546. OPD premium rupees 681. Total premium rupees 12,227. OPD coverage 4 general and 4 specialist consultation. What is included is physical doctor consultation, teleconsultation, consultation with specialist doctors. What is not included is diagnostic test and pharmacy test. Take another example of Niva Bupa. They have a Reassure plan, Reassure 2.0 bronze plus acute best care. Best premium 11,090, OPD premium 5,161, total premium 16,251, OPD coverage 10,000 per member, with an option to increase up to rupees 20,000. They include teleconsultation, consultation with specialist doctors, diagnostic test, pharmacy test. Only the physical doctor consultation is excluded. So that is how they are covering. Now the question is, demand for mental health insurance has surged in recent years, driven by increasing awareness and reduced stigma around seeking help. The growing awareness around mental health has significantly reduced the stigma associated with seeking help from psychiatric counselors. Today, younger individuals are more proactive in seeking mental health service and looking for insurance policies that include mental wellness coverage. Understanding the often long-term nature of mental health treatment, insurers have designed policies to accommodate the ongoing needs of customers, making mental health treatment more accessible and affordable. In India, the cost of care and treatment associated with mental illness is extremely high. As per the Global Burden of Disease study conducted between 1990 and 2017, 1 in 7 Indians was affected by the mental disorders, and the proportional contribution of mental disorders to the total disease burden has almost doubled since 1990. So according to the National Mental Health Survey of India in 2015-16, there is a significant disparity in mental health services needs and treatment seeking behavior. It has been reported that the existing treatment gap for mental health is as high as 84%, with nearly 150 million Indians need mental health service and active intervention. However, less than 30 million seek treatment. So, mental health remains a critical healthcare challenge. Mental health remains a critical healthcare challenge globally. Yet, insurance coverage often fails to meet the needs of those affected. In India, the Mental Health Care Act of 2017 was a milestone, mandating insurance coverage for mental health. However, its impact is hindered by systematic gaps and implementation delays. So, according to a recent study based on 75th National Sample Survey data, only 23% of those hospitalized had some health insurance coverage, and it was just 3.4% among the poorest economic group. So this urges strong advocacy for health policies that include physical and mental health illness coverage. So 1 in every 5 individuals worldwide experiences symptoms of mental health illness, according to the World Health Organization. In India, between 60 to 70 million people are estimated to suffer from common and severe mental health disorders. Statistics released by the World Health Organization say that the average suicide rate in India is 10.9 for every lakh people. So in India, the landscape for insurance coverage of mental health is still evolving. While some insurance companies offer mental health coverage, the policies often provide limited coverage, excluding long-term therapy, outpatient consultation, and certain psychiatric conditions. Despite the legal mandate, the practical application of this law has been slow, and many insurers have yet to fully embrace comprehensive mental health coverage. The global scenario is much further ahead in terms of integrating mental health into general health insurance policies, but India is still in the early stages of this transformation. So the Mental Health Care Act 2017 mandates that all insurance companies include mental health conditions, but in practice, policies often cover only inpatient care or hospitalization for mental health issues, and they may exclude long-term therapies or outpatient care. So major insurance providers have begun offering coverage for mental health issues such as depression, schizophrenia, and anxiety, but these are often limited to short-term coverage or hospitalization. Mental health care is expensive, especially for ongoing treatment or therapies, and many individuals cannot afford the cost despite having insurance. So while mental health organization is covered by insurance, the coverage needs hospitalization for 24 hours, which may not be a case with all mental health concerns. So thus limiting the insurance coverage this narrow escape leaves many individuals with unmet healthcare needs. Insurance policies largely exclude outpatient care, including therapy, counseling, and psychiatric consultation, and essential for conditions like anxiety, depression, and stress, which affect millions. So these are typically managed without hospitalization. Mental health conditions such as substance abuse and self-harm often require rehabilitation services, which remain largely unrecognized by insurance policies, limiting access to comprehensive care. So without coverage for rehabilitation centers, patients face significant challenges in accessing crucial treatment and support. Expenses associated with mental health treatment typically include lodging diagnostic tests, outpatient consultation, psychotherapy, medication, rehabilitation, and even ambulance transportation. So countries like the United States and United Kingdom have made strides in integrating mental health into insurance, including outpatient care. However, developing in nations like India still face significant barriers due to limited coverage that often excludes rehabilitation centers, substance abuse treatment, and preventive care. The insurance policies must include outpatient service, therapy, and rehabilitation and conditions like substance abuse and self-harm, providing holistic care for individuals with underlying mental health issues. Both public and private sectors must ensure the availability of rehabilitation centers and expand access to mental health care across India, especially for marginalized communities. Financial barriers need to be reduced by broadening the scope of insurance coverage to include preventive care and rehabilitation services, ensuring that treatment is accessible without burdening patients with out of pocket costs. So we can draw inspiration from successful models in developed countries, but must tailor them to address India's unique cultural and socio-economic challenges. To create a truly inclusive mental health care system, it is crucial to bridge the gap between policy and practice. Expanding insurance coverage to include a broader range of mental health services, including rehabilitation, will ensure that individuals receive the care they need. Only by removing these systematic barriers can we provide accessible, affordable, and comprehensive mental health care. So the IRDAI introduced guidelines in 2019 mandating mental health coverage, which marked a significant step forward for Indian healthcare. However, the amount of coverage depends on what the particular policy purchased by the insured. Currently, the most common standard insurance policies cover inpatient treatment of mental disorders. Some offer coverage even for OPD services of psychotherapy sessions, consultation, and prescribed drugs. Policies with built-in OPD features provide financial support for diagnostic tests and doctor consultations. However, in person or via telehealth services offering broader coverage beyond hospitalization. So the insurance should include outpatient service, therapy, and medication treatment. The government should provide financial support for underserved population. Regulatory bodies must ensure insurers comply with the Mental Health Care Act, ensuring equitable coverage. Telehealth services should be included in insurance policies to improve accessibility. Thank you very much.